I'm very, very tired.
You sound
Very,
it.
very tired. Fortunately, COVID-19 cases keep going up.
Yeah.
We we we're recording cases. Others are recording cases as well, and
Mm.
it's getting increasingly worrying.
Mm.
But yeah, that's
You,
part
you,
of the reason why today we have to do it on the phone.
yeah, you just don't sound tired. You actually sound very dejected as well.
Yes, because probably over the weekend I was in Kumasi, and we're just not taking this thing seriously enough. The risk mitigation strategies,
Hmm.
the physical distancing, wearing of the mask. I mean, I was at a ceremony, and the pastor had the guts to single those of us wearing a mask and really have a go at us.
Are you serious?
Sɛ Nyankopɔn sɛ wobɛwu a wei ne bɛku a wohyɛ mask o woanhyɛ mask o wobɛwu. I
Wow.
mean, yes, and people found it funny. So I that's my source of dejection.
Yeah.
That across board we're not taking it seriously enough. You get to Medina, Adenta, everybody's going about it's business as usual, and we need to do better because when it comes to the healthcare facilities, we don't have the luxury. We're not blessed with many ventilators, ICUs, or high dependency units, and we definitely don't have the personnel if the numbers keep going up. So
Yeah.
please, 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 we need to do more. Let's cut down on the social events. Let's do the physical distancing. Let's wear the mask and use it properly. And then let us use the hand sanitizers.
Awesome. Well, today we don't get to talk about COVID in detail like we've been doing the past couple of weeks
Mm.
because we need to talk about our women, don't we?
Absolutely. So, Kwame, today we're going to have a discussion about cervical cancer. January each year globally is Cervical Cancer Awareness Month. Just as we have Pink October,
Yeah.
January has been set aside as Cervical Cancer Awareness Month. Unfortunately, because of COVID, a lot of these things are flying under the radar. But we should also recognize that the quote-unquote regular diseases are still present or are still with us.
Yeah.
And we have to make sure that we cover our bases. So, Kwame, let's get talking. Let me share some key facts about cervical cancer. Cervical cancer is the leading and most common female cancer among women in Ghana. Globally, it is the fourth most common cancer in women. In 2018, an estimated 570,000 women were diagnosed with cervical cancer globally, worldwide. That's a huge number. And lastly, an estimated 311,000 women died from the disease in 2018 alone. So the picture is not that great. And what is more worrying is the fact that it is one of very few cancers that can be managed or treated or cured, I should say, if detected early. So if you find so many women dying from it each year, then it is painful. So Kwame, I keep using the word cervical cancer or cancer of the cervix. So where do we find the cervix? The name, so the cervix is a part or forms part of the womb of a woman. So let me just mention that in terms of the anatomy. So the cervix is a part of the womb of a woman. And the name is derived from the Latin word cervix, which means neck. So the neck of the womb, if you like, is what is referred to as the cervix. When you examine the woman through the vagina, what you see, that structure you see at the end of the vagina, the tube, is the cervix. It looks right at you. So this is where we find the cervix. It's a part of the womb. I need to emphasize this because sometimes some women would have surgeries that will remove their womb, and they're not sure whether or not they can have cervical cancer or not. But the womb, the cervix is part of the womb. It's the neck of the womb.
Okay.
So that's for the anatomy. Now, Kwame, how does the disease come about? Almost all cervical cancer cases, that's about 99%, are linked to infection with high-risk human papilloma virus. So there's a virus called HPV. I'm sure we all know about HIV, but this one is HPV, human papilloma virus. It is not just a single virus, but then there are different types. With this pandemic, coronavirus or COVID-19, I think we all now know that there are different forms of coronaviruses. So much the same way, we have different types of human papilloma viruses, HPV for short. And this virus is extremely common and transmitted mainly through sexual contact. So it is an STI. Yesterday, I was looking at some data released by the CDC in America on STIs in America, and the data was startling. It said 1 out of every 4 Americans is infected or will get an STI at some point in their lives. And on top of the list of sexually transmitted infections was HPV, human papilloma virus. But I'm sure in our part of the world, when we talk about STIs, most people would go straight away and think about HIV, gonorrhea, syphilis, and most people will probably not look at HPV as a potential diagnosis. So HPV infection with the virus must be present for cervical cancer to occur.
Okay.
In most circumstances, so 99% of all cases. There are some rare exceptions, and I'll come to that in a bit. HPV infection occurs in a high percentage of sexually active women. So again, when you look at women who are not sexually active, so where you take a cohort of nuns or religious people who for religious reasons are not sexually active or have never been sexually active against another cohort of sexually active women, then we tend to find HPV infection in the second cohort, the sexually active women, compared to the non-sexually active women. And I would repeat it, HPV infection must be present for cervical cancer to occur. Approximately 90% of HPV infections clear on their own within months to a few years of infection, leaving no complications. So I don't want us to be, we should be concerned, but I don't want us to worry too much because 90% of all the infections will clear on their own. Your immune system deals with 90% of all infections because HPV is very, very common. And there are over 150 different types to it. These days we are talking about coronavirus and new strains and all of that. So more than 115 different types have been identified so far. However, over 90% of all the cases of cervical cancer are caused by eight HPV types. Type 16, and they've been given numbers. Type 16, type 18, 31, 33, 35, 45, 52, and 58. It is important that we know these things because, not just memorize them, because you may have HPV infection, but it will not cause you to develop cervical cancer. It is these types, these 8, that form or cause over 90% of all the cases. On the average, only 5% of HPV infections will result in the development of what we call precancerous changes in the cervix. Precancerous changes within 3 years of infection. Only 5% would lead to what we call the precancerous changes. Only 20% of these individuals who have these changes will progress to cancer within 5 years. So the numbers, although the infection, the virus HPV is very, very common, the tendency for it to cause precancerous changes or to cause cervical cancer is low. But 5% of the world's population, female population, or maybe male population, is still a very, very high number. And that is why we're talking about it.
Yeah.
There are other factors that contribute, and not just the presence of the infection. I've mentioned the type of the HPV. The duration of the infection is also important. Certain conditions within the infected person also count. Things like your immune system. So a poorly nourished female stands a high risk of developing precancerous changes if she gets infected with the above or previously stated types of HPV. Those who are immunocompromised for any reason, undergoing cancer treatment, those who are taking steroids, for example, will all have increased risk of developing it. Those females who already have HIV infection, co-infection, with HIV, also tend to develop precancerous changes quicker than women who do not have HIV. There are also environmental factors that make a contribution in terms of the development of the disease. And we are talking about smoking and certain vitamin deficiencies. So smoking, very, very, very important contributory factor. The other thing is poverty and the lack of access to screening programs, which, God willing, next week, when we do a part 2, I will focus mainly on the screening program and then the vaccination schedule to prevent the disease. So, Kwame, how would a woman know that they have got a disease? How would anybody know that they have cervical cancer or features that are suggestive to the woman that they have developed cervical cancer? Well, the physical symptoms may include the following. 1, you may have abnormal vaginal bleeding. Abnormal vaginal bleeding. In my experience, there's a tendency for women not to fear blood coming out of any parts of their bodies except it is a traumatic cause. I don't know whether it is because in their reproductive years, every month, they would have their menses, so most women tend to have a laid-back attitude to bleeding, especially bleeding per vaginum.
Okay.
But every woman must know what constitutes normal bleeding, what their normal menstrual cycle looks like. If you start bleeding differently from what you are used to every month, you should be concerned. And you are within a certain age bracket. Typically, the abnormal vaginal bleeding happens after sex, what we call the post-coital bleeding. So typically after sex, the woman goes to clean herself, or a couple of hours later, she notices that she's bleeding or spotting. This is an example of an abnormal vaginal bleeding. So the women out there, please do not just assume that, I had my menses this and I'm bleeding again, and just assume that it is your menstrual cycle that has been upended one way or the other. The second physical symptom I want to talk about is vaginal discomfort, especially during sex, what we call dyspareunia. If sex becomes unusually painful, not because you have an inconsiderate partner, but you know that usually it is not painful, and you start experiencing a lot of pain or discomfort during sex, then it may be it's something that you want to check out. Number 3, offensive vaginal discharge. Offensive vaginal discharge. And again, this is an umbrella symptom. It could be something else. It could be a pelvic inflammatory disease. It could be candida infection. So again, that's been my experience. Most women, they would attribute every discharge to white, which is the slang we use here for candida, vulvovaginal candidiasis or candida infection of the vagina.
Mm-hmm.
But an offensive vaginal discharge should be of concern to every woman. Even if you think it is white, please talk to your doctor and go and see your doctor, and he will do the appropriate investigation for you. Then lastly, burning pain on urination. Burning pain on urination. Urine flow is not supposed to be painful. So if during urination you've got a lot of pain, then you should be concerned and get a checkup. So Kwame, these are the physical symptoms a woman may experience that should concern her enough to want to go and see a doctor.
Are there certain things that women should do to avoid getting this?
Right. So there are the preventive measures that we are preaching right now to avoid the disease. So, Kwame, I did mention that it's a sexually transmitted infection. If you have multiple sexual partners, human papillomavirus, the HPV virus, it is very, very ubiquitous. It's very, very common. So, if you go from Kwaju, Kwabena, Kweku, Yaw, Kofi, and land at Kwame, then there is a problem. You are increasing your risk. So the first thing we tell a lot of the teenagers, because that's where it starts from, is to try as much as possible not to have multiple sexual partners. Right. So we're not talking morality or religion here. We're just talking strictly from the medical point of view.
Mm-hmm.
Sometimes, too, it doesn't really matter the number of partners you have had. If you go for only Kweku, and Kweku has had multiple sexual partners, Adjoa, Equia, Efia, Ama, and so on and so forth,
then you have to mention
there's
names.
going to be a problem. You will be exposed to the same viruses. If Ama has a virus, and Kweku went to Ama, and now Kweku is with you, then you are exposed to Ama as well. So I think the women, when they are doing their background checks with the FBI or the Bureau of National Investigations, when they beat the van, they should make sure they check the background in terms of the number of partners.
Yeah. I've got a question from Millie as well. She's asking, does vagina washing solutions contribute to HPV infections?
Well, we wouldn't say directly. I mean, I wouldn't totally discount it, but we wouldn't say directly it does. What we know is that when you douche, you change the chemical environment of the vagina. You change the pH of the vagina. You kill the beneficial bacteria that live in there, and you have a different chemical environment if that's a practice. That different chemical environment may contribute, if you already have human papillomavirus infection, to you developing it. So one, the HPV must be there. If you don't have HPV infection and you use any vaginal cleansing solution, the evidence is not there that it will lead to it. But if you have it and then you constantly do these things, you change the pH, the biochemical environment in there, and it will be a contributory factor.
Okay. All right, Doc. Wrap up for us so we can...
All right. So, yes, I was going on about the preventive measures. Now, what we are preaching mostly is the early, the vaccination and then the screening. So I don't know whether next week we'll go into more detail about the screening program and then the vaccines. But there are vaccines available. It is a bit controversial, but I don't see it as controversial because we are encouraging children between 9 years or from age 9 to be vaccinated. So there are vaccines. I mean, today, coronavirus, we are all waiting eagerly to see when Ghana we're also going to get our vaccine. So vaccines have been known to be very beneficial in the prevention of disease. And when it comes to cervical cancer prevention, there is a vaccine. You want to use the vaccine when you have not been exposed to the virus, not after. So right now, adolescence or puberty starts at 9. for girls, 11, 12 years for boys. So we are encouraging for the vaccine to be used starting from that age group.
Okay.
If you are beyond that age group, you can also test. If we test you and you are negative, then we would encourage for you to also take the vaccine. So, Kwame, I think we are hard pressed for time. So maybe next week I will go into the whole screening program. There are cheaper options. I'm sure people want to ask questions about the pap smear, and then the screening with vinegar and so on and so forth, and colposcopy and the treatment options available and so on and so forth. So we'll talk about all of those things, the screening program and then the vaccinations next week. And then we'll take a lot of questions as well.
I'm sure a lot of people have questions that they can't wait for next week. So what's your number? They might want to call you.
Right. So those who want to reach us, it's 0501 477 340. 0501 477 340.
All right. Thank you so much, Dr. Osafo, and see you next week. Yeah?
Yeah, thank you.
Dr. Yaw Osafo is the CEO of Medicas Hospital, and we've been talking about cervical cancer. So it's for women out there. I'm sure you've learned something from this conversation. We'll continue next week, okay? So girls, if you just want to have fun, well, make sure you take care. Have fun in a very responsible way.